video should help you with MIC plates and how we use those and how we interpret those in veterinary practice. Hopefully that seeing this in a video form will supplement what you guys are getting out of your modules as well. When we talk about MIC plates, the MIC in there stands for minimum inhibitory concentration, and what we are really evaluating is at what concentration, what is the lowest concentration of a specific antimicrobial that will inhibit any kind of visible growth of our bacterial isolate. Now in practice, in a diagnostic lab, we purchase these plates that are pre-manufactured to meet our needs within veterinary practice. And so when we actually purchase the MIC plate, it already has specific antimicrobials that have been placed into those wells at increasing concentrations. And you can get a variety of different plates depending on the types of antimicrobials that we are most likely to use in our specific case that we're evaluating. So for example, we may use a different plate when we are evaluating an MIC from a canine infection than we would in a bovine infection, where we may be a little more restricted in which types of antimicrobials we can even use in production animal practice. So that is what goes into our choice of plate right off of the bat, okay? Our next step with the MIC plate is to take this pre-manufactured plate and then add our bacterium of interest into that. So we've already cultured an isolate at this point. We have cultured whatever that infection is, and we have picked an isolate to say this is our most likely pathogen that is causing our problem. And so we take a standardized inoculum of that pathogen and we add that same amount of bacteria in every well on the plate. And so we have the same amount of bacteria in each well, but in each of those wells we also have increasing concentrations of the specific antimicrobials that we're targeting. Again, we're now going to use that, we're going to culture that overnight, and we're going to see if the bacteria grows in there or not. And then the MIC that we are looking for, we will record as that lowest concentration of antimicrobial that actually inhibits any kind of visible growth within that well. On every MIC plate, you will have a few wells that are control wells. And these are really important because in the case of a positive control well, you want to make sure that your inoculum is actually growing. So before you look at any other well to try and get an interpretation, you must look at your control wells to see if they're doing what they're supposed to. So with these positive control wells, you should see good visible growth in every single one of those wells. If you don't, then you really can't trust the results from your MIC plate because you don't know that your inoculum actually worked out to be standardized and viable and to grow well in every single well that you have put it in. So you really need to double check your control wells when you do that. Once you've checked your control wells, you're now ready to actually assess for your MIC. And so you're going to look at these with a very specific table that has to be provided to you. This is not something you're just going to know. You will be given a table that is specific to the plate that you use that tells you which antimicrobials are in which well and which concentrations of those antimicrobials are in each different well. So once you have that table ready to go, you can now look at your well and evaluate each individual antimicrobial. You will see in a straightforward case, you're going to see visible growth maybe in a well or two, let's say. And so you might see visible growth with an antimicrobial in the first two wells, and then you get to a point where the concentration of antimicrobial is high enough to actually inhibit that growth. And so that visible growth will disappear. That first well that you do not have visible growth in is your MIC. And so you will look at that well, and then you will look at your interpretation table, and you will record whatever is from that table. And so if it says that you have a concentration of ampicillin that is maybe a 16, and that is your well that is the first one for ampicillin that you don't see any visible growth, Now your MIC is 16. So that's a pretty straightforward example for MIC in that you have some wells that have growth and some wells that don't, and so you can just record the first one that has no growth as your MIC. But it's not uncommon for us to look at a plate and either have no areas of growth at all, so not a single well for that antimicrobial that has any growth, or on the counterpart of that, maybe every single well in the entire column for that antimicrobial has growth. And so those are both situations we've got to think about for a second as well. So let's think about first, what if you have an antimicrobial and not a single well has any growth? Well, that's actually pretty good news for the antimicrobial, right? It means that even at an incredibly low concentration, it is still able to inhibit growth of that bacterial isolate. So that means that this is probably going to be a really susceptible, the bacteria is going to be very susceptible to this particular antimicrobial. When you actually record this MIC, you don't know if that very lowest concentration well, you don't know if that would have been the first one to inhibit growth, or maybe it would have been even lower than that. Because you don't know that, when you write this down, you record your MIC as less than or equal to whatever that lowest concentration well is. Okay? So, let's think about it on the other side. What if we have growth in every single well? And so now it doesn't matter any concentration that we have tested on our plate, none of those inhibit growth of this bacterial isolate. Well, that's actually pretty bad news now for that particular antimicrobial, because what it says is that this bacterial isolate is incredibly resistant to this antimicrobial. Even at high concentrations, we are still seeing growth, visible growth on our MIC plate with this antimicrobial there. So when we record this MIC result, we know that we have not managed to identify a minimum inhibitory concentration. And so the answer for the MIC for that particular antimicrobial is going to be greater than whatever that highest concentration within that column is. Once you've recorded your MICs for each antimicrobial, the next step is actually pretty simple. You will be given an interpretation guideline for this step as well, where we have worked together as a scientific community to do our best to come up with the MICs for each antimicrobial that are going to tell you if that bacteria is resistant, susceptible, or intermediate with that antimicrobial. The downside with these tables is they're largely based on human medicine. And so we have so many veterinary species that you do have to take these interpretations in light of the fact that a lot of this science is not based in our veterinary species. And so we're not really for sure if our guidelines are exactly correct. Now, in some of the more commonly used antimicrobials and with some of the more common isolates that we get of bacteria, we can feel a little more confident about the results that you get back from this guideline. But going back, once you have your MICs recorded, your next step is now to take those numbers and decide if that's going to be an S for susceptible, an I for an intermediate, or an R for resistant, which will clearly be an antimicrobial that you would want to avoid using for that particular infection. Now that we've worked through all of that, there is one last step, and this is the most important step, in particular as a practitioner. We've gotten you to a point of the result that's handed to you from a diagnostic lab. Now you understand, hopefully, how we got there, where those numbers came from, why they have an S for susceptible or an R for resistant or an I for intermediate next to them. And understanding that process is important in these next steps for your decisions on what you're actually going to choose. There is a lot that is going to go into play at this point. So obviously, you really need to select, first off, something that your bacteria is susceptible to, right? So you don't want to reach for something that we already know isn't going to work very well to inhibit growth within your veterinary patient. So once we've looked at the list and we can see which antimicrobials will work, now we have to pick which one is actually the best. And there are going to be a lot of factors that are very specific to the case in front of you that are going to play into this. Maybe we have to consider adverse effects, the risk of the actual treatment for that patient. Maybe cost is going to be a big factor here as well. Maybe client compliance is a factor. How frequently do we give this medication? For how long should we give it? Is it an injectable versus a pill form? So there are a lot of thought processes and things you need to kind of really go through with the client and with yourself in what this selection will be. Once you've kind of narrowed it down to your realistic list of these are some really great choices now for my patient, then in an ideal world you'll have more than one great choice, hopefully, for the infection that you're dealing with. There is one more step that you can go through that can tell you essentially which one is going to be the most susceptible, and that is your S divided by your MIC. All this is you looking at those provided interpretation standards for susceptibility for that antimicrobial. You take that number that says this is the susceptibility standard for this particular antimicrobial. You take that number and you divide it by the MIC that you actually got. The higher that number is, the higher your S over MIC is, the better that antimicrobial is going to work. And so that can be one last step for you that can help you in deciding which antimicrobial you are actually going to choose. I hope this has helped you master the meaning behind MICs. As always, practice equals progress. So there are a few practice examples on your Moodle page that you are welcome to work through and see if you can figure out some of these finer details of interpretation of MICs. If you get hung up on something, don't get frustrated, just reach out. Ask a classmate, send me an email, respond on the forum, just let me know that you need a little help, and I am more than happy to come and help out.